Okay, so let's look at some different situations where you can actually test the therapy. So, for example, if you're working with somebody who is a nicotine addict, whether they smoke cigarettes or whether they use an e-cigarette, a really simple way to test the therapy is to say to your client, just as they're exiting, as they're about to leave, call them by their name. Hey Joe, would you like a cigarette? Make the ask the question, and just wait and see what the response is. Because it can only be one of three responses: yes, no, or maybe. And if they go, well, actually, no, I don't, you can say, congratulations, you are now smoke-free or nicotine-free. Just don't forget, if for any moment, at any point, if you do experience a craving, don't forget to make that small circle with your thumb and index finger. If you ask the question and if they go, actually, Susan, I do, well, then you can bring them back in, sit them back in the chair, and you can use a rapid relaxation technique, which I will show you on the diploma course. And then there are a number of different strategies that you can use in the moment in order to bring it to their awareness that from this moment on that they have a choice. They can either smoke or they can choose not to smoke. They can vape or they can not vape. But as long as they remember to use their anchor, well, then they can always connect in with those feelings of calmness, confidence and relaxation, and they can always make the right choice. That's your most basic technique that you can use. There's tons of other stuff that you can do in the moment too, but we don't have space for it in this part of the course. And then the other thing they might do is they might say maybe. And of course, if they say maybe, bring them back in, sit them down in the seat, and again, tell them that all of the suggestions I have given you have sunk down to the deepest part of your mind. And right now that you have a choice. In many ways, this is the fork in the road. And there's a beautiful induction called the fork in the road, actually. And so that is a really powerful tool and technique that you can use. But again, you're really highlighting to them that this is their life and that they have the choice, that the suggestions that you have given them are so powerful that if they choose to make their anchor, that they can connect in with those feelings of calmness, relaxation and confidence, and that they can say no. And again, help them to connect with those feelings by using their breath. Now that's smoking and vaping. If we look at other common problems that your client may present, an elevator, fear of elevators, fear of lifts, it can be a really good idea if you can take your client to some place close by, such as a shopping centre, and actually get them to take that first trip in an elevator. And again, make sure that they use their anchor before they do it, before they step into the elevator. And if you want, you can go with them on the first trip. Remember that if they've had a fear of elevators for years, they probably don't even know how to work the buttons in there. So you're not going to do it for them, but you point to the buttons and you'll explain to them, well, that one will close the door. Yes, that one will keep the doors open. So look, if you want to take a moment, we can stand here with the doors open. Just press the doors open button and it'll stay open. Then when you're ready, which floor do you want to take? And allow your client to do all the work while you just stand by. Now, if for any reason they should have a wobbly, they begin to feel a little stressed, anxious or fearful, guess what? Get them to use their anchor. It's as simple as this. Say to them, do you remember your anchor? Okay, so what is it? That's it. Make your small circle. That's it. Nice and discreet. That's it. Take that deep breath in. Yes, connect with those feelings. Yes. Do you remember what those feelings are? Yes, calmness, relaxation and confidence. Good. Okay, now press the button. Excellent. All the way up. And then when you get to the top, step out of the escalator and then say to your client, I'd like you to take the journey down yourself. And remember, you're going to feel calm, relaxed and confident that you can do this. And so at all stages, you're stepping behind your client and you're allowing your client to kind of take the lead. And it's very important for you in a situation like this that you're grounded. So don't be kind of acting fearful and tense and anxious and, hi, are you okay now? Are you sure you're okay? Don't be fussing. Step back. The same way that, I don't know if you've got children or not, but I remember when my children were very small, and they're learning to stand by themselves, and they're learning to take those first steps. We don't go over there and try and help them get their feet in the right place. We don't try and get them to straighten up their back, and we just let them get on with it. And we stand back and we just watch and we absorb and we appreciate the magic of the moment. So you want to adopt the same kind of philosophy. Just allow your client to find their way. You just have to be there if they get anxious. And if they get anxious, you know how to help them deal with that. They can simply deal with that by using their anchor. So whether it's fear of lifts or elevators, whether it's fear of driving on motorways or driving tests, whether it's a fear of public speaking, you will have created an anchor. So whatever that anchor is, make sure that your client has access to it. Now, if your client had a fear of motorways, I'm not suggesting for a moment that you need to take your client out on a trip on the motorway. But what you might do is you might say to your client, our session is almost over, but look, we've got a spare 10 minutes here. Would it be okay if we went out and if we sat in your car and then go out with your client and ask them to sit in the driver's seat as normal, and ask them, is it okay if you sit in the passenger seat with them, and get them then to talk you through a motorway trip, and say to them, so now that the session is over, tell me, when are you planning to go on a motorway? And they'll give you the answer, tell you when, and then get them to talk you through it and say, so how are you actually going to, get onto the motorway? Just talk me through that scenario of what you do in the car. And what you're really doing is you want to get them to talk to you about the mindset, And if you notice any kind of feelings there that they might be feeling a little anxious as they talk about it, just the idea even kind of overwhelms them or scares them a little bit, remind them to make their anchor, okay? And say, connect with those feelings of confidence. That's it. Breathe in that confidence, that calmness, relaxation. Okay, now, and imagine yourself there, on the motorway. Okay, and it's time for you now to exit. Your exit is coming up, okay? So talk me through how you're going to do that. All right. And again, making sure that they have that calmness inside their mind, that confidence and that relaxation, and just get them to talk you through it. And watch out for language. This is so important. Make sure that they speak about their fear, their anxiety in the past tense. Don't allow them to drag that old fear and anxiety up into the present, and don't allow them to project it into the future for when they will actually be in the car driving on the motorway. And it's the same if it's a driving test. Get them again, talk them through it if you can while they're sitting in the car. Get them to place their hands in a position on the driving wheel, that signifies confidence, but that's also the correct place to hold the steering wheel for a driving test, not down here, but where it should be. Etc. So what other scenarios? The same whether it's capture and release for a spider, the same whether it's fear of pigeons and birds in the road. It's just, I've always, when I've worked with a client and they've had a fear of spider, I've just taken them for a walk around on the street. We've looked under window panes and under walls for spiders. With dogs, I've always arranged for them to actually meet a dog somewhere, in the local vicinity. We always go outside of the therapy setting to do that, to make sure that they're calm and relaxed. Same for cats, same for horses, etc. Always arranging to do something like that. And it's making sure so that you this is not something you do after the session, outside of the time of the session. It gets done within the therapy time. So if you have said to your client, our session is going to last an hour and a half, well, then you make sure you're doing the testing within that time frame. Your client still leaves on time, as you know, because that's the end of it. So make sure that the testing fits within the time frame for the session. What other scenarios do we have? Well, weight loss. Now that is the tough one. That can be really quite hard to test, because our clients will have to go and make that test on their own. And the reason for that is that every client is a little bit different when it comes to weight loss. And some clients have problems around the quantity of food that they eat. Other clients have challenges around the food types that they eat. For example, some clients, their problem might be takeaways. For others, it might be sugary snacks and sweets. And for others, it might be overindulgence on fatty foods and fried foods and fast foods. So you'll have to find a way to test it for that unique client. So the way that I generally get around it is I say to my client, so tell me, when's the next time then that you're going to find yourself in a situation that will be tempting? And then they'll tell me whatever, well, you know, usually on a Monday night or on a Friday night we get a takeaway, or they'll say to me, well, I usually do the big shop on a Thursday, or they'll say to me, oh, well, it's somebody's birthday in the office tomorrow, there's bound to be birthday cake and croissants and all sorts of stuff in the kitchen. And then I'll just say to them, okay, what I want you to do then is I want you just to sit in the chair again for a moment, and I want you just to close your eyes. And I want you to bring yourself to that place in the future and to see the possibilities around you. And of course, there is always choice. You can say yes. That is the path of least resistance. It's all too easy to just say yes. But starting today, you don't have to. And over the next few days, you will be tested. But you're going to find it very easy to rise up to the challenge and to just say no. Because all of my suggestions have sunk down into the deepest part of your mind, and there they will be instantly and automatically available for you. So remember to make that anchor. And as you open your eyes now, I'm saying to you, it's so important that when you find yourself in that situation, when you go to work and you hear them singing happy birthday and you go into the kitchen and you see all that food, no one even needs to know you're doing it. But that anchor can be so subtle. You know, it's just those thumb and index finger together. And as long as you make that anchor and take that breath, then you'll find the calmness, the confidence, and the relaxation you need to just say no. Okay, so you tell me this is happening on Thursday. How about we speak on the phone on Friday and you let me know how you got on. So you can see there's lots of different ways that you can actually test the therapy. The most important thing is that you do.